Metro Manila remains under general community quarantine until tomorrow, July 15. It still has the highest number of COVID-19 cases in the country, and President Rodrigo Duterte has yet to announce if government will either relax, maintain, or enforce stricter quarantine rules in the capital region. We now talk to San Juan City Mayor Francis Zamora. Good morning, Mayor Zamora. In your opinion, sir, what do you think the quarantine status in Metro Manila should be after July 15?
Good morning, Ria, and to everyone watching CNN. Well, personally, and of course speaking on behalf of the City of San Juan, I would prefer to maintain our GCQ status. Why GCQ? Because under GCQ, businesses are already opening, livelihoods are already restarting. So we are already able to achieve a balance between the economy and the health and the safety of our people. And this is what we need at this point. Going through guidelines of MGCQ, basically it's similar, except that you are allowing more people or a bigger percentage of the people to go out. And just what you were saying, we can see that the number of positive cases, not just in Metro Manila, but in the entire country, the numbers continuing to rise. So at this point, we really don't want to open up too quickly our city, given the fact that businesses are already allowed to open. For instance, in San Juan, ever since we shifted from ECQ to MECQ, what we did was to impose compliance for return to work plans. So for businesses to be able to open, they need to submit to us their return to work plans. Basically, these are their new normal guidelines, and they need to secure certificates of compliance, giving us the names of all their employees, who among them have been quarantined, who have become positive or have had exposures. So the restarting of the economy is already ongoing ever since we shifted to MECQ. It's just that the national government gradually allows more people to be out, and this is what will happen if we shift to MGCQ already. So I would prefer staying under GCQ at the moment.
Mayor, has the Metro Manila Council met regarding this, and were you able to come up with a recommendation to the president and formally transmit that to him?
We met a couple of days ago, but not really for a consensus. Basically, we were just given guidelines as to how to better do contact tracing, how to ensure that our local facilities are prepared for more patients, and also the national government is preparing more medical facilities for LGUs to be able to send people to. So what we really need is to be able to continue jump-starting or restarting the economy, at the same time maintaining minimum health standards. One thing that was discussed is the fact that we all cannot afford to go back to ECQ again. We all really have to adjust to the new normal. We cannot shut down the economy like what happened last March and April, because we have seen the effects of that. So we all really just have to be able to adjust. We all have to open the economy once again while maintaining minimum health standards.
All right. So, Mayor, basically you're saying we can't, go back to very strict lockdowns as we did before, but you also want to balance that with managing the health situation. So you really prefer the status quo, just staying in GCQ.
Yes. I would prefer the status quo. I know that because a lot of people are out now, and you could see that at our graphs in San Juan, we could see that around the third week of June, the number of positive cases started to rise again. And we attribute this to the fact that people from other cities, from other provinces, from all over Metro Manila are entering San Juan. We understand this, that this is something that's needed, because people who work or do business in San Juan are not necessarily just from San Juan. But one thing that I also saw in my graphs is that in spite of the spike in the number of cases, deaths have been very low. And I'm not sure if the DOH has really assessed this, but what I think is happening is the virus is spreading quickly, but the mortality rate is remaining low. So I don't know if there's something technical or medical about this fact, but this is the data that we are getting. So we just have to really impose more health and safety protocols. In fact, what we're doing now here in San Juan is we are encouraging those who are positive to transfer to our local medical facilities and not just stay home, because those who do home quarantine have a tendency to infect others in their household, their families, their wives, their children. So what we're doing is encouraging them to transfer to our local medical facilities. Although we cannot force them, but we're encouraging them, giving them the benefits of why they have to transfer to our facilities. We provide them breakfast, lunch, and dinner. We provide them free medicines. In fact, we also give 3,000 pesos financial assistance to those who transfer to our local facilities for COVID-19. And this allows us to manage them better. We're able to monitor them. There are doctors and nurses and facilities available to them for free.
That's right. Certainly protecting our families is paramount. Thank you so much for your time this morning, San Juan City Mayor Francis Zamora.